prevention is not beyond us. What do we mean by prevention? Well, there's primary prevention, that's where we take action to stop people developing the disease. There's secondary prevention, where we take steps and tests to identify people at early stage of disease where it's potentially curable. And there's tertiary prevention. Some people are going to develop cancer and we need to do something to treat them and to stop them dying from their disease. Today, at the International Prevention Research Institute, we concentrate on primary prevention.
Cancer prevention is within our control today. We don't need to wait for large investments in new interventions or new policies. If we were to apply what's on the shelf today, we would have a dramatic impact on lowering the cancer trends now and in future.
We have a saying that prevention is better than cure. Prevention is less expensive than curing diseases. But when it comes to implementing, there is very little resources set for prevention.
This is not only an issue in the high resource countries, but even in the low resource countries, as typified by Africa, there are steps that we can take to reduce the increasing burden of cancer in this huge continent.
However, I would like to stress that even in low resource settings, prevention is not beyond the means.
Number one must be tobacco control. And for all smokers, quitting would make a big difference to their lives and the lives of their loved ones. Governments acting would obviously help enormously. But you as a smoker and the non-smokers could be doing a lot more to encourage accelerated programs.
Throughout the 20th century, it became clearer and clearer that there were factors in one's lifestyle that increased the risk of cancer. And it was logical to say that if we reduced the prevalence of those, then we would reduce the risk of cancer and the global cancer burden. And that's turned out to be the case.
There are many cancers that can be prevented in Africa, especially that most frequent cancers in Africa are caused by infections.
We've seen a long litany of causes of cancer, but we know that acting on a relatively small number will have a big impact, be they tobacco, as I mentioned, infectious diseases, and particularly we're learning about many of the viral routes that are amenable to good quality vaccines. Think about hepatitis B, think about HPV, and increasingly we'll probably find other viral routes that are amenable to vaccines.
For example, let's look at liver cancer, which is a big problem. There is a vaccine for liver cancer, but it has not been widely used in most African countries.
In the environmental and occupational space, we don't have to wait to make sure that those proven large causes of cancer for which we can act, including asbestos, for example, today can be acted upon both in terms of improving the quality of the workforce and therefore improving the quality of people's lives.
In the last few years, cervical cancer, which is the most common cancer affecting African women, we have seen a vaccine being made available. A lot of work has been done and the cost of this vaccine has now been reduced. We should take advantage of this and include vaccination programs in our reproductive health programs.
In high resource countries at the present time, we know of modifiable risk factors for cancer that can prevent between a third minimum and about 50% of all forms of cancer. And this is tremendous news, but we've now got to move to the situation where we take steps to implement those prevention programs to reduce the prevalence and the exposure to the known risk factors in communities.
If we look at prevention and take it seriously, more than 50% of cancers in Africa can be prevented. and that would remove the costs and the labor of being sick.
Prevention is not beyond us, but we need to move away from talking about it to actually implement prevention programs, to implement trials of prevention to find out what is necessary to change the distribution of risk factors in populations. And at that point, we will have reduced the number of people who get cancer, and that will be a major contribution overall to cancer control. Prevention is not beyond us.